Hello all, let me introduce myself. My name is Sadia Rohmah. I will present an article entitled Difference of Clinical Feature in Childhood Mycoplasma Pneumonia. First, background. Mycoplasma pneumonia or MP has been reported in 10 until 40% of community-acquired pneumonia cases. They aim to evaluate the difference of clinical features in children with MP according to their age and chest radiographic pattern. Although MP is a small bacterium that can induce pneumonia, the immunopathogenesis of this agent in humans is poorly understood. Clinical and experimental studies support the hypothesis the lung injury in MP infection is associated with the cell-mediated immunity of the host, including temporary energy of purified protein derivatives or PPG, and the dramatic beneficial effect of corticosteroids on severe MP in adults and children. 2. Method. First, analyze the medical record. The They retrospectively analyzed the medical record and chest radiographic findings of 1,091 children with MP who were admitted to the Catholic University of Korea Daejeon Saint Mary's Hospital during a nationwide MP epidemic from January 26 through December 27. 2. Using 2 AGM serologic tests. Select patients with MP using 2 AGM serologic tests, that is the indirect microparticle agglutinin assays, or positive cutoff value more than equal to 1 to 40, and the cold agglutinin titers or positive cutoff value more than equal to 1 to 32. IgM or immunoglobulin M is the first antibody secreted by the adaptive immune system in response to a foreign antigen. 3. Evaluate the pneumonia patient according to diagnostic antibody status. 4. Statistical analysis. Statistical analyses were performed using the statistical project for the social science for Windows version 12. Continuous variables are reported as the mean plus minus standard deviation. Next is result. First, clinical and laboratory characteristic of pneumonia according to age. The mean age of the subject was ranked 9 months until 14 years, and the male to female ratio was 1 to 1. The patient had symptoms and signs indicate of pneumonia at the time of admission. All patients had a fever more than 38%, more than Celsius per axilla and choke, and the majority of patients had abnormal breath sounds on auscultation. Of the 1,091 patients with MP, 86 were sequenced or AGM negative at admission to AGM positive at discharge for both assays, and 1,050 positive patients saw increased MAA titers with corresponding cold agglutinin titers during hospitalization. Next is clinical and laboratory findings according to pneumonia pattern. The mean age of the bronchopneumonia group was significantly younger than that of the segmental or lobar group. The total duration of fever and the length of hospitalization were longer in the segmental or lobar group than in the bronchopneumonia group. Next, clinical and laboratory findings according to severity of pneumonia. They analyze the clinical and laboratory parameters of the subgroup of 81 older children aged more than 6 years of age. They divide and evaluate the school-aged children into 3 groups according to severity of pneumonia. As previously stated, the patient with more severe pulmonary lesion saw higher CRP level and higher proportion of seroconverters. The duration of fever and absolute lymphocyte count were significantly different between bronchopneumonia group and the severe segmental or lobar pneumonia group. Next is clinical and laboratory findings according to diagnostic antibody status. They evaluate the clinical and laboratory findings of this subject according to diagnostic antibody status. Those who were seroconverted and those who had increased titers. There were no difference between the two groups in clinical and laboratory indices, except for platelet count. Next is discussion. The epidemiologic characteristics of pneumonia may differ among populations. They found that MP affects children of all age groups, whereas the clinical phenotype of MP differs with age. Compared with the younger children, the older children had a more severe clinical course manifested by longer total duration of fever, higher CRP or C-reactive protein, and a more severe pneumonia patterns. Next is conclusion. The clinical phenotype of MP differ with age, with a longer period of fever, higher CRP, and more severe pulmonary lesion observed in older children. The severity of pulmonary lesion was associated with lower lymphocyte count and higher seronegativity IgM antibodies at presentation. Next, short-term paired IgM serologic test in the acute state may assist in obtaining an early, definitive diagnosis of MP and reduce bias in patient selection. Further studies are required into the pathogenesis of pneumonia infection. That's all for me. Thank you.